In 2020, Jordan's population is estimated at 10,203,134 people. According to the World Bank, Jordan hosts over 1.3 million Syrian refugees. Also in Jordan, non-communicable diseases, NCDs, account for 78% of all deaths, which exceeds the global average by 7%. This can be decreased by reducing major risk factors for NCDs, including tobacco use, physical inactivity, and unhealthy nutrition. Established in 2005 under the direction of Her Majesty Queen Rania Al Abdullah, the Royal Health Awareness Society develops and implements public health programs in partnership with the public and private sectors, as well as civil society organizations, to empower the Jordanian community to adopt healthy behaviors through raising health awareness. In 2020, RHAS partnered with Novo Nordisk Foundation and the World Diabetes Foundation to intensify efforts aiming at reducing the burden of non-communicable diseases. Together, we have implemented 3 projects, one on integrated NCD humanitarian response, the second on COVID-19 response, and the third on type 1 diabetes. These projects target Jordanians, especially those of vulnerable groups and Syrian refugees. The Integrated NCD's Humanitarian Response Project aims at unifying NCD's prevention efforts in Jordan, improving access to care for people living with diabetes and other NCDs, and prevent the onset of all NCDs through implementing activities within 3 main tracks: community level, health center or security delivery level, and public policy level. To encourage collaborative and collective efforts, diverse and representative implementation, coordination with relevant stakeholders, and achievement of the overall objectives of the project in line with national priorities, we have formed steering and technical committees of representatives from ministries and governmental institutions such as including Ministry of Health, Ministry of Education, Ministry of Youth, and NGOs including Caritas, Institute for Family Health, FNET, and UN agencies such as World Health Organization, UNHCR, and UNRWA. At the health centers level, in Amman, Karak, Madaba, Jarash, Mafraq, Irbid, and Zarqa, the Healthy Community Clinic model was adopted by 82 Ministry of Health centers, 9 Caritas centers, and 5 Institute for Family Health centers. The Healthy Community Clinic model aims at building the capacity of participating health centers, providing preventative NCD services to patients and individuals at risk to empower them manage their diseases and improve their health and overall life prospects. To that end, 285 medical staff were trained and 15,000 Jordanian and Syrian beneficiaries received preventative services where they attended a series of awareness sessions that aim at equipping patients or individuals at risk with information and the know-how on creating behavioral change with regard to preventing or managing non-communicable diseases. Awareness efforts were complemented with one-to-one counseling sessions led by nutritionists to focus on patients' individual needs. At the schools level, as for integrating NCDs, preventative activities to reach students at a young age in partnership with the Ministry of Education, 110 schools were selected from 34 different communities, including 3 UNRWA schools reaching 60,000 students, of which 5,500 are refugees with awareness initiatives. The project also builds the capacity of teachers on delivering NCDs-related awareness, emphasizing on the importance of physical activity and healthy eating habits and their role in preventing NCDs as well as COVID preventative measures. Youth volunteers and community health volunteers level. In partnership with the Ministry of Youth, a network of 110 youth volunteers were trained as peer educators on topics related to NCDs prevention, and they in turn reached 4,000 of their peers. Moreover, 10 volunteers from 10 community-based organizations were also trained and reached 700 community beneficiaries to date. We joined efforts with the Institute for Family Health, where 19 community health workers were trained on health promotion tools and techniques. By the end of the project, the community health workers are expected to conduct 10,000 household visits. Type 1 diabetes affects about 15 per 100,000 people worldwide. Its incidence and prevalence are indeed increasing. While type 1 diabetes cannot be cured, it can be managed. This was achieved through developing a project dedicated to addressing diabetes type 1, with the aim of improving knowledge and practices on managing the disease, improving the capacity of healthcare providers to respond to the patient's needs, and enhancing the sustainability of the national response to type 1 diabetes in Jordan. COVID Project. As the COVID pandemic ensued, NCD patients were among the most affected by the virus. RHAS implemented the COVID-19 Response Project, which included launching a campaign to raise awareness on COVID-19 and its preventative measures, as well as improving vaccine uptake by the Jordanian community. This was combined with providing those at high risk with necessary information through healthcare providers and community volunteers. Several tailored trainings were conducted to build the capacity of 300 healthcare providers, 150 community health committees who relayed information through sessions to their community members. In addition to building the capacity of 390 youth volunteers who disseminated related health messages to more than 2,000 of their peers with the aim of halting the spread of coronavirus, 20 Ministry of Health centers and 10,000 beneficiaries were provided with personal protective equipment. Moreover, more than 3,000 patients were supported with PCR tests and glucometers to help them monitor their health status. The project's social media campaign reached more than 200,000 people around Jordan and supported the Ministry of Health's efforts in the vaccination campaign with a direct donation towards vaccination efforts. We also integrated technology solutions in implementing our response activities. A chatbot was created and featured on the Ministry of Health official COVID website to answer people inquiries regarding COVID and NCDs, serving more than 30,000 unique users. And in collaboration with Al-Tibi, 10,000 patients were reached through virtual telehealth services. Also in partnership with the Ministry of Youth, an innovation hub was launched to help drive communities' innovation in responding to challenges with regard to the pandemic. One of the winning projects addressed blood donation issue in Jordan, which was acknowledged by His Majesty King Abdullah II and was institutionalized at MOH. We paid close attention to mental health, which was compromised during the pandemic. RHAS launched Sakoon, a series of 20 podcasts focusing on mental health in light of COVID. We seek better health prospects in advancing the right of health to all, and we plow ahead towards a better Jordan and healthier communities. We can only do that when we all partner together as individuals, communities, and nations.